Hey there, and welcome. Let's talk about the spine. Have you ever heard a doctor or a physical therapist use a term for a spinal condition that's just a total tongue twister? Yeah, you are definitely not alone. Today, we're going to crack the code on 4 super similar and honestly really confusing terms for spinal issues. Spondylosis, spondylitis, spondylolysis, and spondylolisthesis. They're a real mouthful, right? They all start with spondylo, which makes them incredibly easy to mix up. I mean, even medical students get these tangled up all the time. But trust me, by the end of this, you'll be able to tell them apart like a pro.
So, here's our game plan. First, we're going to uncover a simple little secret that's hiding in plain sight within these words. Then, we'll dive into each condition, one by one. After that, we'll do a quick-fire review of the key differences. And we'll wrap up with a really important principle for what to do when pain strikes.
Okay, let's get right into it. The secret to finally understanding these terms isn't in the beginning of the word. It's all about the end.
That's right, it's the suffix, the last few letters of each word, that tells you pretty much everything you need to know. It's the cheat code. Once you learn these 4 endings, you have basically won half the battle.
First up is osis. Whenever you see osis, I want you to think degeneration. It's all about the kind of wear and tear that just happens over a long period of time.
Next, we've got itis. Now, this is a classic. You've probably seen this one before in words like arthritis or bronchitis, and it always means one thing: inflammation.
And then there's lysis. Lysis literally means a separation or a break. So for what we're talking about today, just lock this in your brain. Lysis equals a fracture.
And finally, we have listhesis. This one might be new to you, but its meaning is actually pretty straightforward. It just means slippage. Picture one thing slipping forward over another. So quick recap, we've got degeneration, inflammation, a break, and slippage. Let's see how this all works.
All right, now that we have our secret decoder ring, let's put it to use and break down what each of these 4 conditions really means.
We're going to start with spondylosis. See that suffix, osis? Right away, that tells us we are dealing with degeneration, good old-fashioned wear and tear of the spine.
So you can basically think of spondylosis as age-related arthritis in the spine. It's what happens after years and years of mechanical stress. This is exactly why it usually pops up in middle-aged or older folks, and why the pain tends to get worse when you're active.
Okay, now let's switch gears to spondylitis. The suffix here is itis, and we know what that means, right? Inflammation. This is a completely different animal from simple wear and tear. And notice the huge contrast here. Spondylosis was about wear and tear. Spondylitis is an inflammatory problem. A lot of times it's linked to an autoimmune response. And look who it affects, younger people. The pain pattern is a dead giveaway too. It's often worse when you're resting or at night, and you get some serious stiffness in the morning that lasts a while.
Our third term, spondylosis. Remember the suffix? Lysis means a break, and that is exactly what this is. We're talking about a fracture in a very specific little part of a vertebrae.
Yep, it's typically a stress fracture in this tiny little bone bridge in the back of the spine. It's called the pars interarticularis. It's super common in athletes who do a lot of repetitive back extensions. Think gymnasts, divers, football linemen. And sometimes the pain can shoot down one leg.
And that brings us to our final term, spondylolisthesis. Remember our last suffix, listhesis? That means slippage, and this condition is, you guessed it, exactly what it sounds like. One vertebra actually slips forward over the one beneath it.
Now this slippage can be caused by a few different things. Sometimes it happens because that spondylolisthesis fracture we just talked about makes the spine unstable. And the result isn't just back pain. If that slipping bone starts to pinch the spinal nerves, you can end up with nerve pain, numbness, or even weakness in your legs.
Okay, we've broken them all down. That was a lot, I know. So let's put everything side by side to really drive home the differences and make sure they stick.
This table puts it all in perspective. Spondylosis, think degeneration, wear and tear, usually in older adults. Spondylitis, think inflammation, often in younger adults with pain at rest. Spondylolysis, that's the stress fracture, the break, common in athletes. And finally, spondylolysis, that's the slippage, which can lead to nerve issues. See, 4 very different conditions, all unlocked by their endings.
Now, it is absolutely critical to remember that you need a professional to diagnose any of these conditions. But it is helpful to know a general principle for managing pretty much any acute injury that pops up.
For a lot of acute injuries,
Two of the very first steps are often rest and ice. Rest just helps to prevent making things worse, and ice can help get that initial inflammation under control. But again, this is just a basic first aid concept, not a specific treatment plan for any of these conditions.
And this right here is our most important slide. I want to be crystal clear, this is all for educational and informational purposes. If you are having back pain, you must go see a qualified healthcare professional. They are the only ones who can give you an accurate diagnosis and create a treatment plan that's safe for you. Please do not try to self-diagnose.
So there you have it. We've untangled the spondylo puzzle. Now you know the secret really is just in the suffix. And that brings me to a final thought for you to chew on. Now that you get the difference, how can understanding the language of health empower you to ask better questions and take a more active role in your own care? Something to think about. Thanks for tuning in.